Hello, everybody. Fayth Caruso here. Yay, this is my very first bellicon live video. So really quick, our topic today is going to be pelvic floor, all things pelvic floor. So I am a certified personal trainer, Pilates instructor, and I've been teaching rebounding for over 10 years, and it is hands down the most popular topic is pelvic floor. I used to really think about it a lot, but it wasn't until I had my second child that now I'm thinking about it a whole lot more. So that being said, I invited Dr. Katie Taylor. She has her doctorate in physical therapy, and she is owner of Taylor Physical Therapy and Wellness. She does all things women's health and pelvic floor health, and so we're going to bring her on for some questions. I have to read Dr. Katie's just like her very brief sentence on her website, her mission, because I feel like it's really inspiring for all of us. She helps women struggling with pre- and postnatal conditions, pelvic floor dysfunction, breast cancer, osteoporosis, and orthopedic pain return to the activities they love. So I feel like that's our moment of truth today. But can I start with the first question?
Sure.
We dive in? Okay. So we've all been told to do just Kegels. Do some Kegels and your pelvic floor will be strengthened and you'll be fine. And we all know that it's not that simple. So it's a different approach. Can you share kind of the most common misconceptions around pelvic floor health and kind of break those myths?
Yes. Well, first off, thank you so much for having me. I'm super thrilled to connect with you and talk about the pelvic floor and how that can sort of be a part of bouncing and the rebounding and all the things that you guys do. So thank you. Yes. So there is this huge misconception that's so, I think, deeply embedded in women that we either learn from our mothers and grandmothers, we hear from conversations with friends, that just do Kegels is a one and done fix for everyone, for every condition, and for every symptom. And that could not be further from the truth. There are many conditions that women and men can experience that doing a pelvic floor contraction, or a Kegel, as they're sometimes called, can actually do a lot of harm and can do some damage, cause people to become more symptomatic, and is actually the opposite of what we would want to do. And so while it is appropriate for some to do that, yes, there is a time and a place to do that, it is honestly, like for the majority of my patients, not where we start. And in fact, many women come to me and they say, well, I've been just doing my Kegels and Kegel, and it's not getting better. I'm still leaking, or it's not getting better. I'm still having pain with sex, and it's not getting better. I'm still having these issues. And that's one of the first things I say is stop Kegeling. It's not what we need to be doing. So I think that I would say to that end, in terms of the misconceptions, is that this is a huge part of our health, a huge part of our bodies, and our pelvic floor, our bowel, bladder, and sexual function is such a big piece of our quality of life. And so there is so much more to that than I think so many of us once knew, or even still know. And we deserve more than to just do a Kegel to fix it. So, yeah.
Besides coming to see you, which all these people are from all over the world, so they can't all see you, although you can all follow her on Instagram because her page is really fun. She gives really good tips. What are a few things that if somebody didn't have immediate access to you, they could do? What would you recommend?
Yeah. So if you are, I think to kind of answer that to start off with is that I will just kind of put a plug for the profession as a whole, is it is growing, and there is a good likelihood that there is a pelvic floor specialist, hopefully relatively close to you, that you can connect with, for one. But yeah, so two is if you are experiencing any type of dysfunction, issues, concerns with, again, sort of those three broad categories of bowel, and that can be, I have chronic constipation, I have chronic diarrhea, I have bloating, I have pain in my rectum when I have bowel movement, like whatever that is, or I have bladder dysfunction. So I'm having leaking, I'm having, a lot of urgency, frequency. I can't do my bouncing because I leak all the time. or you're having some form of sexual dysfunction, and that can be, again, pain vaginally, that can be pain in the tailbone, hip, low back, pubic bone. All of those things are big, like ding, 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 something is going on inside of your pelvis. And so I think the first thing, again, I would kind of circle back to your first question, is that if those things are happening, to not always jump into doing Kegels. And there's often a lot of other and more effective things for us to do. For example, there's a lot of really great stretching techniques that you can do for the pelvic floor. And the reason I say stretching is because the pelvic floor is really, I love to use the analogy of an elevator. Mm-hmm. So picture our pelvic floor is like this, it's like a sling essentially, and it goes from our pubic bone back to our tailbone. And so essentially it helps to support our bladder, our uterus, our rectum, and our other pelvic organs. And so it needs to be able to go up the elevator to help support that. So say we have to go to the bathroom, but we're bouncing on our rebounder and we need to contract. So we're going to go up that elevator. Okay. When you're off and you're resting and we're just sitting like this, you need to be on the ground floor. We also need to be able to take the pelvic floor down to the basement. And that's when we are having birth or bowel movement or other scenarios where we kind of have to bear down. So all that to say is that for some of us, we're hanging out on like the penthouse. We are so tight and so contracted that we are already up there. And so if we go to do a Kegel and we're tightening, we're hitting the roof, and it's not effective. It can hurt. It's not basically doing anything aside from potentially causing issues. So stretching is often a really nice place for us to start. And so I love doing child's pose, happy baby, a deep squat where you're literally almost like sitting on the floor. Yeah. And then I think the other big thing, Fayth, is to look at our breathing mechanics. Yep. So imagine our right under kind of like the top of our rib cage. There's our diaphragm, okay? Under that, we have all of our intestines, our organs, and the bottom of that little rectangle is the pelvic floor. So when we breathe in and out, the pelvic floor should be doing this. It should be moving up and down. And what we see happen in women and men with pelvic floor dysfunction is that they tend to be like shallow chest breathers. Yes. And so we need to realize that breathing needs to be a third here, a third rib, and a third abdominal. And so really kind of just lying on your back, knees bent, feet flat, and just kind of take inventory. Put one hand almost like a little C shape, like right here, one hand on the abdomen. Can you feel both of those things moving? You should feel both areas of the body moving, and really kind of keying into, can I take a breath in? I love to kind of take a breath in for 4, hold for 2, and out nice and slow for a 4 to 6 second count. Yeah. And that really can help to just start that process of moving the pelvic floor and getting it to come out of that super contracted position.
I love that. It's funny. I sometimes talk about the breath and like the pelvic floor needs to release and contract. It's kind of like the mat when you bounce, it goes down and up. Yeah. And so it reminds me of that. Like you don't want the bellicon mat to just stay up. It has to be malleable like that. So yeah, I love that image because it does the same exact thing. Yeah. Another really common question we get is, okay, I'm rebounding. This is more specific to rebounding. And we get this a lot with people bouncing. We're rebounding. And our pelvic floor strength, we think it's improving, but we're not sure. How do we know what should we be monitoring to know, okay, is there a problem or is it just taking time for my pelvic floor to get stronger? Are there signs? Like when do they know is something's not right and we need to go get something checked out?
Yeah. So I think that's a great question. When we think about how we can strengthen the pelvic floor, we have to realize that these are muscles, and a muscle, just like we might think of strengthening our quads or, biceps or whatever that is, can take in a healthy, non-injured tissue, like weeks, if not months, to see a measurable change, depending on what the load is and the frequency and so forth in our exercise regimen. Yeah. And so the pelvic floor is no different. I would say, first off, it can take some time to see a measurable change. But the other thing that I'll say is that, again, kind of circling back to what I was saying earlier, is you are not experiencing leaking, vaginal pain, heaviness, pressure, other things like that, or for men, pain in the penis, or you're not having issues with like erectile dysfunction or other things like that, then I would say like keep doing what you're doing, because we may be trying to chase something that's not an issue necessarily.
That's super valuable, because I think that's one of the most asked questions is, and I tell people that, I said, you know, it's going to take time. You know, when you're bouncing, you're not going to have this immediate, you know, all of a sudden my pelvic floor is strong in a week, but it's going to take time and, you know, repetition to reformat those muscles and kind of retrain them and relax them. So that's really good to hear. That's very encouraging. Are there any, this is a question that somebody wrote in and asked. They said, we know it's important to empty the bladder before rebounding, but what advice would you give any new people who are new to rebounding and they're concerned about their pelvic floor? Would you tell them to maybe start on their back, or just start with gentle bouncing, or just start with breathing? What would be the best intro?
Yeah. So I think starting with the breath work is a great starting point. And I think to really have a good understanding of that when we're quiet and we're lying down and the torso is not moving can really be a nice way to lay a foundation for more upright, gravity dependent positions. And then we add in movement. And so that often kind of gets lost in that translation. So certainly kind of mastering that first. And I think that, you know, rebounding can be similar to other forms of exercise, and starting off kind of low and slow is going to be the ticket, if you will, and kind of starting off doing maybe even on a solid surface off of that, and just doing some pedaling, and start doing just some gentle kind of up and down movement. See how you feel with your breath. See how you feel with, again, any pelvic pressure or discomfort. It's not realistic for us to think that when we do a whole workout, even if it's like a 10-minute quick thing, for us to be able to maintain the pelvic floor in this super tight position. That's not what we really are wanting, and it's really going to be unrealistic of us to kind of expect that. So again, I would say more to monitor how you're feeling with, again, leaking, pain, pressure, and that type of a thing.
So start slow. Don't go into your high intensity interval or bouncing really high. Like we have to tell people, especially with rebounding, it's almost like learning, not quite, but it's almost like learning how to swim. It's a completely different medium and way of moving. And so you have to start slow. And then the benefit, if you kind of build that strong foundation, the rewards will be reaped if you can slow it down, come back to alignment and posture and all the basics.
Yeah, and I would say, I mean, certainly if you need to use the restroom beforehand and you haven't gone, that's great. But I call it, or pelvic floor specialists often call it, jicking. So the just in case peeing. So I kind of avoid that. If you've gone to the bathroom within 10 minutes before you started your workout and you are like, let me just go just in case again, that can actually train the bladder into becoming more of a habitual thing without it actually being necessary. The bladder is a very trainable part of our body. And so it's not just for that particular workout. It's like, oh, I'm just going to go before I leave, or I'm just going to go, you know, those types of things. We usually try to train the bladder to be in a more of a habit of not doing those things, so it doesn't increase frequency throughout the day.
That's really interesting. It's like a mental game. Like you think, okay, every time I have to go, but maybe don't OCD obsess over that.
Right. The bladder. So it's interesting because our bladder and the nervous system are very connected. And so for some people, hearing running water can trigger that need to go. For some, it's hearing like keys, like, okay, we're pulling in the driveway. I know I'm almost home to the bathroom. Like, I got to get in and go in the bladder. And that's when a lot of people experience urinary symptoms or leaking, is because we associate it with a particular sound, or again, like right before I hop on my rebounder, like whatever that looks like.
Yeah. That's fascinating. I have never heard that. So I have to be very mindful when I pick my music for my pelvic floor restoration. No waterfall, relaxing music.
Right. There you go.
Oh my goodness.
So this is probably my most important question. How can we make the pelvic floor fun again? Because I feel like whenever that topic comes up, everyone's like, it's a little depressing. It's like, oh, my pelvic floor. And it's like, we want to do the opposite, not stress over the words pelvic floor, but try to make it fun again. And do you have any ideas?
Yeah. So I think that I'll just, one of the simplest ways to think of it is like, we no longer have to dread it because we know more about it and we know how to get relief from issues with the pelvic floor. So just like you might get excited to get fit and get in better cardio shape or better tone in your body, the same can be said for pelvic floor. And once you learn the tools to do that with, like, I think it's a great tool because so many women that I work with, it's like now they can get back to running or to doing whatever it is that they're passionate about and that they love. And it's not even something that's a concern anymore that they dread because there's relief that they have found. So, yeah.
I can say after I had my second daughter, like postnatal, I didn't bounce during my pregnancy. That was just a personal choice, but I was so excited to be able to just get back into movement. So like the idea of just stepping on the bellicon rebounder and like being able to start moving again, that was like, okay, I'm having fun.
Yeah. And I think it has to be just, you know, a part of other routines or a part of doing things that you love. So I work a lot. I'm a busy mom and a lot of my patients are just busy working people, right? We're busy people. Yeah. And so it has to be something that like works for you and works into your schedule and into your day. Yeah. Not like we have to think of it, oh my gosh, I've got to sit down and now do like 20 minutes of my pelvic floor work and wah. Like, of course that's boring and nobody wants to do that. So it's got to be part of like, for example, I had a patient just this morning that's really big into CrossFitting. And so we were just working on how she can do like her power presses and mix that in with her mom stuff and just kind of making it part of like a more sprinkled in. So it's not this daunting, dreading thing. That makes sense. Yeah.
Yeah. No, I love that idea. We don't have a lot of time. So I tell people with their bellicon, I'm like, you got to leave it open. You got to leave it out and somewhere where you're going to look at it every day, because otherwise, you know, you'll find something else. You'll walk past it. So, you know, mine is like in my dining room instead of my dining room table, but that's okay. And I have to talk about two more things and then I'll leave it open to questions. This isn't necessarily having to do with exercise, but it's something that we had a few comments on. You have a quote on your Instagram page: just drink wine is never an acceptable treatment option for painful sex. And I feel like I had 3 girlfriends tell me that after I had my first baby. And so it roared at me when I saw that quote. So comment.
Yes, I have a lot to say on this. Okay, so pain with sex is common but not normal. And that is so, so important for us to understand and to realize. And I think that so many women are told by their providers, which in my mind is like the worst thing, right? These are people we're supposed to look to for advice and help. Oh, it's normal. Just relax. Just have some wine. Listen to some music. Just use more lube. Like, you'll be fine. And that's just so far from the truth. There are so many things that are literally structurally going on in the vaginal canal that are causing these women to have pain. And so there's one condition is one example that's called vaginismus. There's another one that's called interstitial cystitis, patients with endometriosis, pelvic pain after pregnancy. There's so many things that women are can be going through that can cause that. And wine is not going to fix it. It's not going to do anything, you know, to help relax that. And so I think that there's just like, we need to stop spreading that myth to women that they just need to relax. It's like just doing the Kegels. Well, if they're doing Kegels, they're probably way up on the penthouse, and that's part of the problem. And then they've been told to drink wine, and that's not helping anything. So it's just this whole thing. So I feel like I get so fired up because one of my biggest missions is to just educate the public at large that like, this is a part of our body we got to start paying attention to. And this is a part of our body that there are real things happening. There's real treatment out there. There's effective treatment out there. And it's something we can no longer ignore and just tell people that it's going to go away and become better with just wine.
So my last question, are there any absolute contraindications, like any issues or conditions where you would tell somebody, do not, and let's exclude pregnancy because pregnancy is sort of its own topic, where you would say, absolutely do not do this type of movement.
Yeah, in reference to rebounding.
Yeah.
Yeah. So,
or would you say only gentle bouncing and avoid big one? Are there any conditions?
Yeah.
Overall.
So I think, and so you may have said this, and I heard something about pregnancy, but I think with pregnancy, it can be patient dependent and a woman's choice. But really there's a couple of things like preeclampsia and placenta previa and other things that would create more of a high risk scenario that women are typically not going to be doing as much exercise, and certainly impactful things. Yeah. There are certain heart conditions that you would want to, and certainly a patient is going to know that. You're going to know that about yourself if you have like certain things going on and you have maybe atrial fibrillation or a pacemaker or things that you obviously have had that conversation with your medical team to get clearance with. But I think in a really big sense, like our bodies are made to move. And when we don't move, that's when we get in trouble. And that's when we develop back pain. And so if anything, I think that the misconception is that, you know, oh, I've got this terrible back pain, or I've got this awful neck issue, or these types of things, and I can't do anything. I think either out of fear or they've been told to just rest and it'll get better. And unfortunately, that's actually not true. We know from a substantial amount of evidence that movement is really one of the best and most effective treatments for those things. And I think, like you said, you can do very gentle bouncing. That's honestly probably less, or, you know, and you may have data on that comparative to just level ground walking that you all are doing. So I would say, no, there's not going to be a substantial amount of contraindications for that.
Move, 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 everyone, move.
Bodies are made to move. Yeah.
I love it. So everybody, if you have questions, please post them. I will be available to answer them. And if you have questions for Dr. Katie, please follow her on her Instagram. She gives amazing daily advice. I can't thank you enough for being here. This is like absolutely perfect. Exactly what we needed. For those of you who
go ahead.
I was going to say, for those of you looking for just a few foundational exercises to start with, we have a new video on Bellicon Live and Bellicon Home. That's pelvic floor foundations. It's 20 minutes. It's very simple, and it goes over a few of the things that Dr. Katie mentioned. So take a peek at it, and that's a great starting point. But I'll let you finish. Last comment.
Well, I was just going to say, I was trying to flip through because I'm so not techie, you guys. And Pilates by Kelly said hormone imbalance. So if you want to elaborate on that, I'm happy to chat about how that kind of comes into play with my world and kind of what we do. Most of the time, hormone issues, and that can be before menopause, during menopause, like after, they create a lot of tissue changes, and women go through a lot during that period of time. It can affect the vulva, the skin dryness. A lot of women have pain with intimacy in and around that time period. So I'm not sure. I can't tell when she made that comment to see if that was kind of in and around that time.
I think it was during the painful sex, maybe. I think.
Yeah, so that is a very common thing. And so we work a lot on just skin care and how to care for that tissue and make that a more comfortable and ultimately pain-free thing for women. So yeah, I would love for you guys to follow me, and you are welcome to send me direct messages with questions. I'm always open. Again, my whole thing, like I love my patient care, and I'm just so passionate about it, but I also I love being able to educate at large. And so if there's certain topics that you guys have, like, please let me know, and I'm happy to try to create content that can help just to keep that learning and that conversation going about the pelvic floor.
Thank you. This was amazing. Thank you all for joining. If you just joined, I will save this so you can watch it. And like I said, we'll try to share some movement ideas too later on for those of you who are looking for where to start with rebounding. Okay. Happy evening.
Thank you so much.
Bye.
Great night. Thank you. Bye-bye.
Okay, now I have to figure out how to get off live without ruining this.